The commemoration is aimed at remembering the loved ones who succumbed to HIV AIDS and comforting those living with HIV.
No gaps from ARVs and other drugs as a result of the US government policy review.
Uganda Aids Commission reiterates government's commitment to have HIV drugs and treatment in government hospitals across the country and urges those living with HIV to take heart and continue on the right dose of that treatment.
Minimum disruptions, but they have since been addressed. I know that when you're reporting, you'll concentrate on the disruptions. The disruptions have since been addressed. How have they been addressed? First of all, even within the US government arrangement, they have reorganized to make sure that, although, for instance, the USAID structure is still under review, but the CDC, the Centers for Disease Control, which is an agency of the US government, is now the mainstay of delivery of their support.
However, besides government's different interventions like free HIV testing and counseling, free treatment, giving free condoms to ensure the end of HIV by 2030, the new infections are worrying, especially among young girls aged 15 to 25 years.
In Uganda, when you look at the number of deaths, in 2010 we had 200,000 people dying because of AIDS-related complications. In 2023, we had 20,000 only people dying because of the AIDS-related complications. So Uganda is on track. Uganda is on track to meet the targets. We believe that Uganda is one of those countries that by 2030 will declare an end to HIV and AIDS as a public health threat.
Uganda Aids Commission and UNAIDS are calling upon global partners to join hands in these last miles of the 5 years to end HIV by 2030. Winnie Ainembabazi Katwire and Mike Bakabulindi for UBC.